My name is Cheryl Van Epps. I'm a resident of Essex, Vermont. 10 years ago, I suffered a complex head injury. The head collision left me with skull fractures, a moderate traumatic brain injury, chronic nerve pain, and mental health issues. I joined patient advocacy organizations at the national, state, and local levels to fight for better patient safety and quality of care. I was not provided the brain injury nor the mental health care that I needed when I needed it most. In the exam rooms of 4 different physicians, I broke down sobbing, yet none of my physicians recommended or referred to me to mental health care. As a result of waiting to see if I improved, I returned to school without any accommodations for unrecognized cognitive and mental health issues I was suffering. My trouble snowballed until I suffered a mental breakdown. These delayed diagnoses and interventions caused my issues to worsen. It wasn't until 5 years later I finally got an adult psychiatric evaluation. They found I suffer PTSD. 10 years later, I am still unemployed. Lessons from my and my peers' similar patient experiences inform us that our primary care physicians, our emergency department staff, other health professionals, sports facilities, and school staff need to improve and gain more knowledge in the area of prevalence of brain injury and mental health issues. We need to recognize the signs and symptoms of brain injury and mental health issues. We must understand the importance of acting upon this knowledge. Right now, we have no idea how many Vermonters had survived a brain injury and currently go undiagnosed and untreated. We know a high percentage of survivors like myself also suffer mental health issues. We also know a high percentage of brain injury co-occurs in incarcerated and homeless populations. So why aren't we screening and evaluating more frequently for brain injury? Why aren't we integrating mental health into our medical health care plans? Our months-long patient wait times are evidence that Vermont, as is all of our 50 states, we're not receiving sufficient federal funding to meet our patient needs. We patients are asking our leaders to speak up to Congress on our behalf. Where should we invest additional funding? To rebuild our system to capacity to meet our patient needs. To improve health professional training so they can better identify our needs. To invest in frontline workers like community health workers, peer support, peer mentors, patient advocates, to fill in the current gaps in our system. To fund organizations like NAMI and Brain Injury Association of Vermont. To involve patients in policy design and decision-making. As each of us rely on our healthcare system to work for us, we rely on you, our political leaders, to represent us and to fight for our needs. Thank you for listening.